We had hoped today to be able to announce that metropolitan Melbourne would take some significant steps, not from today but from midweek, around retail, hospitality and a whole range of other important next steps. We're not in a position to do that today because we have at least 1,000 test results from that northern metropolitan outbreak that are in the labs. We will get those today, probably the balance of them tomorrow, and there will be additional testing conducted throughout the day. This is not anything other than a cautious pause to wait to get that important information, to get the results of those tests, just to rule out whether there's more virus there than we think. Ultimately, if we can link these cases together, if we can link different outbreaks, then we have confidence that we have contained it and we can move forward. This is not a setback, it is simply waiting and being led by the data, being led by the science and following public health advice. That is what has seen these numbers go from thousands of active cases to now 100 active cases. That's the approach that's seen us go from 700 plus cases per day to 7 cases. This is the strategy. It is working, but it is appropriate just to be doubly sure that there's not more virus out there in the northern suburbs than we think. We have found linkages, we have found chains of transmission. Jerome can speak to this. There are hundreds of people that, because of testing, have been able to leave their homes. They've essentially been released from that third ring of contacts, of close contacts. The system is working, the processes are working. We just have to wait and get the results. There's no good doing targeted testing if you then don't wait to see what the results of those tests are. I do hope to be able to make definitive announcements about opening up in metropolitan Melbourne in a couple of days' time. We'll keep people updated today, tomorrow, and those test results will come back, and hopefully what they will show us is not just some additional cases, and there's bound to be a few in that mix, but that those cases are linked and that we know that there is a chain of transmission and we have our arms around those people and they're not spreading it to anybody else. You've heard me say many, many times that numbers, when they're this low, become less important than the narrative and the story that sits behind them. If we can link these cases, then we know that we have control of these cases. If they are random, if they are not linked to each other, if they're mysteries, then that would be a real cause of concern. We are hopeful, more than that in fact, we're confident that we have found many linkages. There may be others, and there may be other cases that come forward as a result of those tests that are in the labs right now. I know it's very frustrating. I know people were very keen to have a very long and detailed list of changes to the rules. It is not appropriate for us to do that now. It will be in the next couple of days, and we will not be, I don't think, really in any meaningful way behind the schedule that we'd already set. Today I was to announce some things that would come into effect on Wednesday. We just need to wait for these important swabs to be processed in the labs just to rule out that there is widespread community transmission in the northern suburbs. It is a cautious approach. I know it'll be frustrating for people, but we've all come so far, we've all done so much, we've all achieved so much. Now's not the time to let our frustration get the better of us. Let's wait for these results. They will come through. The public health team are doing an amazing job.